All right, it's 10 o'clock, so we're going to get started. Welcome. My name is John Donadio. I'm the Executive Director of the New Jersey Association of Counties, and I again want to welcome all of our panelists and participants today for the first in a series of 7 workshops on COVID-19 related matters. We put together, I think, 7 outstanding workshops, kicking off with this one on crisis management by county leaders. But before I introduce our panelists, I want to take a minute to thank our sponsors, both Prime Point and Yorktown. We wouldn't be able to host these workshops without their help. I hope Jim Jacob is on the line, because as a sponsor, he gets a minute to do an elevator pitch of his terrific business, long friend of the New Jersey Association of Counties. So Jim, are you there?
I am. Can you hear me?
Yeah, good to see you too. It's good to see you, my friend.
Good to see you, my friend. It's been too long.
Yes, sir. You're not kidding.
It'll be great to get a hug one day.
You got it.
Hey, we're delighted to be a sponsor. As you know, we're big fans of NJAC and all the work that you do and the freeholders do in the counties across the state. And we thank you for your all the efforts and work that you put in. It's been a challenging year, and we're here to help. So, hey, I'm sure most of you know that Prime Point's a New Jersey prominent brand, providing payroll processing, HR support, time management solutions to thousands of businesses across the whole country, all 50 states, in dozens and dozens of industries. But what you might not be aware of is how prominent we are in New Jersey County and municipal government. We've had the honor of serving Union County and Sussex counties for the past several years. In this past 12 months, we've begun serving Mercer County and Essex County. And it's been a real treat to have them come on board. But, you know, with each county that we've brought onto our service, they've told us that they've chosen us for 3 primary reasons. And first is our experience with New Jersey government. We've been serving New Jersey government for 40 years. 40 years. I look good for 40 years serving municipal government. And what's interesting is, you know, they also have been commenting to us about how the immediate attention that they get from our service teams. And then the other big factor is the flexibility of our technology, where we can bring customizations and integrations to our county and municipal partners. Sometimes they have an HR system that they want us to integrate with. Sometimes they have a time system they want us to integrate with. They want us to provide uploads to finance systems and other systems. So it's that integration that brings a ton of efficiency to municipality, and you know, you can accomplish so much more with the same staff that you have, and that's what's been a real blessing. And also, hey, we do the same thing for over 140 New Jersey municipalities, cities, counties, cities, townships, boroughs. And then finally, we have led our industry in quickly developing solutions needed to help businesses and government navigate through the COVID-19 relief packages. I mean, those packages have put a big burden on business and government, and we have been working tirelessly to develop solutions. In fact, we get some clarification on a particular issue on a Friday. We develop the tools over the weekend. We roll them out on Monday. And what's really special is we roll them out into our existing platform, into our existing HR payroll platform, and we never charge additional fees for accommodating legislative changes that come down upon you and upon us. So it's kind of unheard of in our industry, and we equate it to what we did for Chapter 78. When that was signed into law, we built the solution, the calculation engine, we rolled it into our system, made it available to everybody, didn't cost a dime. And then, you know, I would just encourage you, freeholders in the counties and across the state, you know, talk to the counties that we serve, talk to Union and Sussex and Mercer and Essex, and get a report card on how Prime Point's doing. And we'd love to have you consider us. We would love to engage in a conversation to see how Prime Point might be able to help you in your county and your special and specific needs. So don't hesitate to reach out to us. Again, I'm Jim Jacob, one of the principals and founders of Prime Point, and we'd love to talk to you. So thanks, John. Appreciate your help and all your support over the years. We appreciate it.
Great. Thank you, Jim. I appreciate it. Again, it was great to see you and the picture of your beautiful family behind you.
Thank you.
Bird, I don't know if I like the bird or the apple better. Good backdrop. Appreciate
Thanks,
it.
man.
Great seeing you. All right. Next up, we have a new friend to the association, and it is from Yorktail. And I believe we have Ken Scatura, who's the COO and president of Yorktail. But I know Steve White with Yorktail is here, so either Steve or Ken, you have a minute to pitch your business.
Yeah, John, thank you. And thank you to the association for having us here today. My name is Ken Scaturo, and I am the president and COO of Yorktail. We are new to the organization, so we're excited to become more involved, not only from a sponsorship perspective, but as helping being a thought leader, certainly across the state and across the counties within the organization. We are a minority-owned business. We're headquartered in Eatontown, New Jersey. We have about 25,000 square feet in Eatontown. We just recently acquired a company based in Somerset County, in Somerset itself. We have another 26,000 square feet up there as well. We're about 400 people strong, have been in business for 35 years. And our focus is really on IT services and solutions, really focused on digital workspace transformation. Think of what we just did with COVID and moving from office workers to remote workers, and what are the tool sets that we have to use to do that? How can we be most productive doing that? How do we monitor, ensure reliability and security while we're in this new mode of work? We've been doing collaboration. It's in our pedigree for these 35 years. So we understand it. A lot of people, this is very new to. Doing virtual meetings like this is very new. And we do understand the intricacies of how it works and how it's supposed to work. And we're at the highest levels of partnerships with companies like Microsoft. We've got 8 gold certifications and 3 silver certifications, Zoom, Cisco, and others. So we're really looking to partner with states, counties, public sector on how do you make that transformation? How do you do that digital transformation? Think about your voice systems within your counties and municipalities, and how a lot of people still aren't picking up the phone. Right, they're using their desktop like we are today to do this, and the cost savings are very strong. So how do you move to that? How do you move from Skype for Business to Teams to Zoom and the rest of those? How do you train your workers to do that? There's one thing of getting everybody stood up and getting some headsets on, but what are all those best practices related to the collaboration component? So these are the things we do. We think we can certainly help with you and help drive productivity within your workforce. We've been a trusted supplier of the state for many years now. We do Bristol Myers Squibb, right, a big employer in the state. We manage their collaboration infrastructure globally. We have organizations like the Social Security Administration and the Treasury. So we do big things with big companies like the Walt Disney Company, but we also do it with small companies and small organizations as well. So we're excited to be part of this organization. We're optimistic that we're starting to turn the corner on some of these things. All right, I did listen to the Dr. Fauci yesterday as well, as I heard some of the preamble to this. So hopefully we can get through this. We have our website that's in the pack. So if you have questions, comments, concerns, or really just want to talk about how we can help you with your digital transformation, please reach out, and we look forward to being more active in this organization. So thank you.
You, Ken.
Great. Thank you, Ken and Yorktail, and of course, Jim and Prime Point. We appreciate your support and being here today. And before we get started, and I introduce our certainly esteemed panel, just a couple of housekeeping items. If you have any questions throughout the presentation, please use the question and answer icon on the bottom of your screen, not the chat button. Use the question and answer session, and we'll answer it as we can. There's a couple of breaks during the presentation that we'll do our best to answer it. So with that, I'm very pleased to introduce our panelists. First, Mr. Anthony Vinova, who is, I guess, the godfather of county administrators. So he's the Passaic County Administrator. Very happy that Mr. D is here today. And also part of that is Mr. John Benani, who's the Morris County Administrator. And then Terry O'Connor, who's the Monmouth County Administrator, and NJAC Second Vice President. So welcome to all of you. I appreciate you being here a great deal and look forward to hearing what you have to say. So it's all yours. Show's all yours.
Thank you, John.
Okay, Angela, can we bring up the PowerPoint, please? Perfect, thank you. Okay, good morning, everyone. John, Tony, and I are honored to speak with you this morning and present this very first session of the NJAC conference. I want to thank the NJAC staff for pulling this together. We're all faced with different tasks every day, and this certainly was one that we weren't sure we were going to be able to pull off, but they pulled together, and here we are. So I hope everybody enjoys. Please ask questions as we go along, because we really want this to be an interactive process. So Angela, slide 2, please. Thank you. So crisis management by county leaders. And I think that anybody who's a county leader knows that we thought prior to March, we had a good handle on crisis management. Many of us had lived through Sandy or Irene or snowstorms. But I think, you know, at this point, we all now have a PhD in crisis management, because this pandemic, you know, showed us things that, or presented us with things that we had never been faced with before. And one of the biggest challenges was county government across the board never closed. We continued to provide services. We continued to make sure our constituents had what they needed, all the while trying to manage our staff and get services out to first responders, long-term care facilities, hospitals, and all the first responders. So this organization grew stronger through this period of time. We leaned on each other. We learned a lot from each other, sometimes what to do, what not to do. And we continue to share, because if somebody's already solved the problem, the best thing to do is give them a call and see what their input was. So what we want to take you through is what we saw initially, what we did during the pandemic, and what we see for the future. So slide 3. The very first thing that became apparent that we were going to need to deal with was personal protective equipment. Everybody was looking for it. It became a very sought after item. In Monmouth County, we fortunately had a stockpile. Our OEM office was very proactive in making certain that we had, you know, a stockpile of PPE, which, you know, had been ordered through the normal vendor pool, and we continued to order. Unfortunately, we were all faced with, we were competing with across the nation with everybody ordering PPE. So we ended up activating our emergency procurement process, which made the process a little bit easier for us. And then we started to buy from vendors, and everybody seemed to have PPE or was in the process of making PPE, and they could get it for you next Wednesday or 90 days from now, whichever worked out. For the most part, it worked out well for us. We had a printing operation, a company in Monmouth County that within a couple of days was able to make masks and face shields and things of that nature. So for the most part, it went well. We did have, and again, all of the surgical grade equipment needed to go to the hospitals, you know, per the governor's order, it needed to go to the first responders. So employees who weren't first responders, but who were working, needed face coverings, and those were the cloth type face coverings. And we were ordering those. We ended up with one batch that I don't think could fit Barbie dolls, but for the most part, the entire process went well for us on PP. We also started up a call center. We relied heavily on our volunteers. I can't say enough about them. We started a call center because what we were finding is our emergency operations center was inundated with people who just had questions. People were concerned, they were scared. There was a lot of misinformation out there. There really wasn't. CDC was changing guidance as they got information. So we staffed a call center, and so people could call in and they could talk to an OEM person or a nurse and ask questions, but not rely so heavily on our emergency 911 system. We also used those volunteers, our MRC volunteers, our Teen CERT volunteers, to put together kits that we were able to distribute, which consisted of the N95, mask, gloves, gowns, goggles. And we found that we had a lot of towns' first aid squads calling and saying, send me all the PPE that you have. So fortunately, through our OEM, we were able to go back and look at the size of the towns and their normal call volume, because you could have a large town, not densely populated, that didn't need as much PPE as they thought they might need, or a smaller town had a number of long-term care facilities, or was more densely populated with assisted living facilities that may need more PPE. So the data that we had stored over time really helped us determine who needed what, so that we didn't have PPE sitting at locations where it really wasn't of use. Slide 4, please. In keeping with the PPE theme, we had people calling in and asking that, where could they donate? They had a box of gloves or they had a case of Clorox wipes. So we activated our donations management plan, set it up over at our county college on March 25th, ran it for about 10 days and solicited PPE donations from anybody basically who would give them to us. We went on radio, we did press releases, and we ended up with a significant influx of PPE. You can see about 2,300 masks, 90,000 gloves that we were able to get to first responders and towns' first aid squads who needed it, while we waited for the national stockpile to arrive in Monmouth County. To date, we have distributed 140,000 pieces of equipment of our own, and we pushed out over 2.5 million that eventually came from the state stockpile. We also have ordered and have a stockpile for the next anticipated wave, and I would recommend that everybody be prepared because you're going to need it, if not for this, for what comes next. Looking at it is better than looking for it, especially when everybody else is looking for it. We actually went so far as I actually called the nursing schools in Monmouth County, as well as the superintendent of schools, and asked him to go raid the school nurses' offices for personal protective equipment. And we replaced it once we were able to do that. But that's, the depths of which we had to go to, because personal protective equipment was very difficult to come across. Next slide, please. So the first positive case in Monmouth County was reported on March 9th. I think this is one of those things where everybody's going to remember where they were when this happened. I was in a meeting in Newark at NJTPA. My health officer called, and I hopped in my car and drove down the parkway and turned on the radio and could hear more cases being reported by all the counties and, of course, across the nation and across the world. So we knew this was going to be different than a Superstorm Sandy or we're usually, crisis management is weather related for us in the past. So this was a totally different deck of cards that we were dealt. So once we had PPE and our emergency services, our OEM center set up, our volunteers in place, we started to look at, what can we do to curtail what might happen with the economy, and to avoid layoffs, furloughs, if we would have to close down programs, nothing that the Board of Freeholders wanted to do. So on April 1st, we initiated a hiring freeze for all but the most essential of positions: the health department, the frontline workers, the social workers, buildings and grounds workers. And we also have a promotion freeze. And both of those things still exist, because we're not sure, and we'll talk about revenue a little bit later on, where this is all going to end. And again, promotions only if somebody in a key position leaves and we need to fill that position. Slide 6, please. Some of the other proactive steps that we took, we cut off all non-discretionary purchases effective late summer, even if it was in the department's approved 2020 budget. We just decided that it was, at this point, we needed to take the last quarter, take a breath, take a look, and see what was going to happen to us from a financial perspective. We also took our capital budget from 130 million to 25 million, really scaled it down to only do because you've got to preserve your infrastructure. And we bought the necessary equipment to support that infrastructure. But everything else we put on hold because we still don't know where we're going to be 2021, 2022. Next slide, please. So we'll talk about revenue. We're going to start with the bad news because you end with the good news, and that's on an up note. So that's how I like to do these things. Whenever somebody says you want bad news or good news, always want the bad news first. So just a personal preference. So as of August, our interest income is down for a similar period in 2019 by $1.7 million. And our sheriff sales are down $2.5 million. We'll eventually get the sheriff sale money. The question is when the governor will allow sheriff sales to resume. And the other issues, smaller amounts of money, but all significant for operations. Our surrogate is down about $94,000. And while that's not a lot of money, it could affect her cap. So we may be looking at relief from DLGS next year for her. Obviously our shared services costs are down because we've not been doing, and the towns have not been doing anything other than core functions. And in Monmouth County, we run a ferry service from the Bayshore area to Manhattan. We were taking about 1,300 people a day back and forth on March 9th. And we're taking today at 100. And there was a period of months when the ferry service in its entirety was shut down because nobody was able to commute to Manhattan. And, of course, the other thing we're all going to need to look out for is the state budget cuts and what that's going to mean to the to our budget. So on to the good news. Next, okay, thank you. Our county clerk revenue is up. Interest rates are down and people are refinancing. And so that's good for the county clerk's fees. And also, I think this is pretty much across the state, the real estate market is hot. In Monmouth County, it's not unusual for a house to be listed, to be sold within a week, and to be sold for more than asking price. And I know in talking to some of my counterparts, that seems to be what's going on. A good number of people are coming out of the Manhattan area and they want to live in New Jersey, work remotely from New Jersey, or even if they have to return to Manhattan at some point, they want to, they want to live and raise their families. Our park system, and again, I think this is also statewide, is having a banner year. Golf rounds are over what they were in revenue from last year. There was a period of time when golf was the only activity that you could do if you had the time. And I hope none of my staff is listening because they didn't have the time. Our reservoir, the rental of boats and canoes, people wanted to be outdoors. If there's a positive to any of this, it was good to be out recreating. Kids were outside, not home on computers necessarily. And our camps, our park system was able to run camps this summer, which were, I think parents were looking for daycare opportunities. And we were able, in conjunction with our safety office, to set up camps so that everybody was socially distanced. And fortunately, we were report that we didn't have any COVID cases. Our fall programs, our registration, most of the classes are full. There are 1- and 2-day programs that run from toddlers to adults, golf lessons, ceramic lessons, dance lessons, and those are all full for the fall. So the parks revenue has really skyrocketed, and for that we are very grateful. And the next thing we'll go on to, Administrator DeNova will be testing centers. But John, if we could take a break at this point and see if there are any questions to date.
Yes, I actually have a question for you, Terry, and it goes back to the PPE.
Mhm.
And this may sound like a silly question, but where are you storing, like you're storing the PPE equipment and an issue? Where do you store that?
Our OEM has identified several locations, warehouses, and distributing to the towns, making sure, and the hospitals and the long-term care facilities. So it was brought into us, and then it was with volunteers distributed out to those organizations that really needed it. But fortunately, we have storage facilities, and if we didn't, I would have, we would have bought trailers. We would have figured it out, because, like I said, looking at it is better than looking for it.
Right, great. And then just a related question concerning what were some of the just initial challenges as a county that you faced in securing the PPE? I know I was on an email chain with the purchasing officials and still am, and they were working 24 hours, a day, 7 days a week.
They were faced with a number of things. Obviously, first complying with local public contract law,
Right.
and then we were all competing for the same things, and we were competing nationally. It wasn't just New Jersey; it was everybody looking for the same thing. So there were vendors who were saying that they could provide, thinking they were going to get it from whoever their supplier was, and they could get it to us. So you would give them a purchase order to deliver, let's say, gowns, and then find out that they couldn't deliver something for 90 days, which at that point seemed like an eternity. We needed PPE like now. We were, when you're counting gloves to see how many, boxes you have as opposed to cases, that's not a good situation. So we all wanted to avoid that. And again, the national stockpile was promised, but it took a while, to get here, because that's what happens.
Great, thank you, Terry. We have a procurement. Hold on, we have a question here. How has technology helped to communicate and coordinate within and across the counties and municipalities?
Well, obviously, this is an example of the technology, and I think that we've all mastered Zoom and WebEx and GoToMeeting, and I don't know many have mastered the mute button, because I think we've all heard and seen things we wish we hadn't seen or heard over the.
Terry, not everyone on this call has mastered the technology.
Right.
We won't
That's
mention
correct.
Bonnie's name, but
But it certainly, technology certainly has made things in terms of communication, especially with employees. And I think we'll deal with communication a little bit later on. But I think that, one of the key things was making sure everybody was informed. Employees were informed, the freeholders were informed. We were on daily calls with the state as to what was happening. If not for technology, it would have been much worse.
And we have one more question, but I agree with Mr. DeNova, which is why we have Angela Wolf manage this Zoom call today, because if it were me, we'd be in a lot of trouble. So the question that and Angela is doing a great job, so thank you. Did you see, and this is the last question and then we'll move on, did you see any price gouging with the PPE, particularly early on?
Actually, one of the things that was, again, you have to look for the silver lining in this. We didn't, and again, there were certainly, and a good purchasing department keeps that from happening. They get on the phone, they negotiate, we're not going to pay you $100 for a pair of gloves. It's not going to happen. So I guess it was out there. We didn't experience it. My purchasing department might be screaming right now if they're listening, because they did all that work. But everybody really pulled together. We had people calling saying, you know, I want to help. How can I help? I have PPE. We're going to, you know, retrofit our manufacturing plant. What do you need? What should we be looking at? Even when we were, you know, rating the school nurse's office, everybody gave up what they had. It wasn't nobody was holding on to it. It was really a team effort. Everybody pulled together. So we didn't see much of it. Like I said, I think I think it affected everybody personally. And I think everybody kind of came at it from that perspective, even early on.
Great, thank you, Terry. And you know, that's a great point. And I have to say, you know, being on the email chain with the purchasing officials, they really kind of came together, even though they were competing, you know, against each other. They worked remarkably together. I mean, if someone came across you know, a good contract in Camden County, they would share it with Monmouth County and Bergen County, and they were just communicating on a regular basis. And it was, you know, it was really a privilege to kind of be a part of. So they really did a fantastic job. So next up, I think it's Mr. DeNova.
Thank you very much, John. I appreciate it. I appreciate the opportunity to, as they say, a good leader never wants to be the smartest person in the room, even if it is virtual. And that is certainly the case, sharing this forum with both Terry and John. I think as administrators, we all came together and relied on each other, and both Terry and John are excellent at what they do, and I appreciate all of the guidance that they gave me during this crisis and ongoing crisis. So next slide, Angela. Next slide. I'm going to talk about testing centers. So one of the first things that the state required all of the counties to do was to set up testing centers. Here in Passaic County, we were very fortunate that we already had a memorandum of agreement with William Patterson University. Obviously not for COVID crisis, but for other crises, that if we ever had to set up pods, that we would be able to do that. So that certainly cut off a lot of time here in Passaic County being able to set up our site. The FEMA site in Bergen County, I think, was the first up and running site. And then I believe Union County, followed by Passaic County. We were the second county run site to be set up. We opened on March 25th, and we kept that drive-through site open till June 20th. One of the unique things here in Passaic County was that our site was run completely with volunteers. So we made calls out to the community, Passaic County, and had volunteers from other counties as well, health professionals that came every day. And the one that always sticks out to me is Dr. Wallace from Wayne Township, 84 years old, a retired pediatric neurologist who showed up every day at our testing site and never said boo. All she did was want to work. And it really was, with all the help of the volunteers, an incredible life-changing event for me to see people coming together in crisis and doing it for nothing other than they knew it was the right thing to do and that we needed to test people as quickly as we can. So Passaic County, we ran our site not through appointment, and we required a prescription from a doctor in order to be tested early on. About the last 30 days, we opened it up to asymptomatic residents. We wound up being able to test about 120 to 140 people an hour, which was pretty incredible. And I think 760 tests were done in one day, which was the most of any of the days that we were testing at our drive-through site. So as you'll see, we tested almost 16,000 residents. We then began to talk about what would next steps be as the drive-through site was beginning to quiet down, and we were, going from testing 500-600 people a day down to 150, 200 people a day. We started looking at options of what we were going to do next. We made a contact at Rutgers University to see about using the saliva test. And through that connection with Rutgers University, they connected us with a company called Vault Health. When we met with Vault Health, they talked to us about an at-home program that they were starting for corporations, and many of the professional sports leagues, as well as factories, and going into factories and testing employees on site. So we converted that into an at-home testing program here in Passaic County, which was, proud to say, the first public entity to offer at-home testing in the United States. And we were on calls with, had to be at least 6-8 different states throughout that process, asking us how the program was, how we operated it, how we were able to get it done. And it's a simple process of people go onto our website, they order it, it gets delivered to their house, they go on a Zoom call with a health professional who guides them through the test, they place it back into a FedEx envelope, return it back to Rutgers, and within 24, 48, 72 hours, depending on volume, they get the results emailed to them. And you'll see that we did 6,000 to date, 6,636 tests. And those are individuals, because the at-home testing is limited to one per person. So those are 6,600 unique individuals that have used the at-home testing, and it certainly has worked well with the elderly population and the disabled population who couldn't get out or can't get out. And then we have, in conjunction with that, have done mobile testing. So we have 16 municipalities in Passaic County, and we have, now we're in our third round, I believe, of mobile testing, where we go into each one of those municipalities from 9 a.m. to 3 p.m., first hour being set aside for first responders. And we go in and we use the same Rutgers saliva test. And to date, we have tested over 11,000 residents there. And that has gone over very well too. Passaic County is quite unique. If anyone has ever seen what Passaic County looks like, it's a little bit like an hourglass. So we go from the border of New York State down to the lower portion. We're very diverse. The upper part of the county is very rural. In fact, we just put in a first traffic light not too long ago in our upmost county, upmost municipality in the county. And then we come down to suburbia and then our urban centers. So we like to say we have a little bit of everything in Passaic County, absent a shoreline. But we have tons of lakes, tons of mountains, and our urban centers as well. So we're pretty unique, and we felt that doing mobile testing was the best way to try to get to and from, to the people that needed testing as well. Next slide, Angela. So I pulled together a COVID team, we called it, which included, of course, my office, our clerk to the board, our county council, obviously our health department, finance, procurement, OEM, our IT professionals, law enforcement, and buildings and grounds. And together we were able to, within about 12 days from our first meeting, have our site up and running. I can't say it enough, and I know it's already been said, but purchasing agents really did an outstanding job. Our issue was we had the site ready to go, we had it laid out, we had everything in place, we were waiting for PPE. And obviously couldn't start the testing until we got the PPE. And I can't tell you how many emails I was sending late at night, 9, 10, 11 o'clock at night, figuring I'll get the response the next day, and my purchasing agent, responding to me almost in real time, that she had been on the phone. And I know there was a question earlier. I don't know if there was price gouging as much as if you weren't making the decisions quickly, that to place the orders, that the next time you called, because of supply and demand, that prices would have been up. So not necessarily gouging, but again, we live in a supply and demand environment. So one thing we learned early on was don't go around and try to be penny wise and dollar foolish, right? Even if you thought you can get it for a couple of bucks less, if you could get it, place the order and get it. So the COVID team, really, we worked very, very long hours throughout the entire process to make sure that we got our test site up and running as quickly as possible. As I said earlier, we did it at William Patterson University. Patterson there is spelled wrong. It's 1 T, not 2. My fault, by the way, and my alma mater. Having the MOU in place with the university really saved us so much time. And I have to say that the president of the university and his staff couldn't have been any more welcoming to us. Next slide, Angela. So we did lots of site visits in order to get the implementation. We did go to Bergen County and take a look at how FEMA had set up their sites. When we were talking about the mobile sites, Bergen County had just set up some mobile test sites as well. As I said, you didn't want to have to recreate the wheel if you didn't need to, because honestly, we were making decisions quicker than I think any of us had ever made decisions in our lives, and they were very serious decisions with consequences if they were wrong. So again, having people like John and Terry at my disposal to pick up the phone, being able to call up the executive in Bergen County to say, hey, can I come over and see what you guys are doing, make sure that, you know, we're doing it right, and you know, also the benefit of understanding what went well for them and what didn't go well for them, and learning by other people's mistakes, if you will. Next slide, Angela. So again, we talked about volunteers, 210 volunteers. We did training for each one of those volunteers in our police academy. We had training videos. Everyone was and anyone who was volunteering had to train. We created a ID card for them so that we knew who they were, and any residents coming knew that they were working for us as well. In the prior picture, I think you saw what the prior slide, you saw what the test site looked like. We had 2 lanes operating in a parking lot. We were fortunate that William Patterson has a tremendous amount of solar panels, and that helped us in some inclement weather to protect not only the workers, but the residents who were coming to get tested. And as I said earlier, our first resident was tested at 8:05 a.m. March 25th. On that first day, we tested 144 residents, which we thought was a lot, until we, and you know, the irony was 8:05 we opened. I believe that day we closed at around 3 o'clock, and we thought 144 residents was great. And as I said earlier, we wound up testing 500, 600, 700 people in less time as we went on. The volunteers got better at what they were doing. We got better at what we were doing. We opened up more test sites to register people quicker. And then each day, on that day, we had a hot wash, a little recap of what went well. And we did that every day after the test site. So we got our, you know, dealing with the volunteers, some of the cream rose to the crop. We had 3 young gentlemen who were had studied and were about ready to do the residency, and then when COVID hit, they couldn't, and they became our 3 key volunteers. So each day, my health officer and myself, a few other staff members would sit down and we'd go over what worked, what didn't work, and how we needed to make it better the next day. And you'll see in that picture, other than my ugly mug there, all of those people standing there are volunteers, and it was incredible. Right down to you know, the woman all the way to the left. She ran our tent and our supply tent, volunteered every day, and most of the time left our site, and she was a volunteer EMT for the Township of Wayne, and wound up doing a shift there. So, as I said earlier, in many ways, a life-altering experience for me to see the best in humanity. Next slide. That it for me.
Well, thanks, Tony. So we'll talk just a moment about what we considered or what we thought was the most at risk as we move through the pandemic. Next slide, Angela, please. And you know, we kind of talked about who became the most at risk, and what I saw from the Morris County perspective was it was those residents of long-term care facilities, DDD facilities, behavioral health residential facilities, homeless shelters, religious infirmaries, housing authorities, youth shelters, and generally the chronic homeless. Next slide, please. You know, from my perspective, and I think you know, again, it just bears repeating because Terry and Tony both said this. You know, the partnerships that we developed, and we have a long-standing relationship, and although we kid around a lot, those jokes all really related to us really relying on each other and moving through this. Because honestly, if it wasn't for the relationships that we all have, I don't know how any of us could have gone through this. We've all, I mean, I've been around since, you know, I think I remember calling Hurricane Floyd a major disaster. And, you know, that really, when you think about it, that was like a tropical, maybe a little drizzle compared to what we've just been through. And most of the events, and as Terry had said, most of the things that we've all been through have been weather events that have turned into human service events. You know, whether it's snowstorms or Sandy or Irene, clearly they're just weather events, but ultimately they're long-term human service events. But this one was extraordinary, and the only way we were able to get through this was a partnership. The only way. It really defined teamwork, and I mean that from the governor's office on down to the local town hall. From my perspective, I was fortunate enough to work with a great group of freeholders who really just understood what had to get done and really supported everything that had to get done. And all of my counterparts, all the administrators listening, were just on the other end of a phone call. And honestly, no matter what time of the day it was, they got back to, you know, there's a level of communication that exists that you just wouldn't believe. And honestly, everybody has a great idea. Everybody had a great idea. Most of us were on the phone every day with Mike Delamarter from the governor's office for about the first, I don't know, 3 months, right? He'll probably be known mostly for saying, please put your phone on mute. But, you know, I got him my hat, you know, honestly, the man did an incredible job. But partnerships became the only way that we could really look at minimizing the spread of the virus. We had to identify the need and the management and the supply of PPE. We had to identify required alternate facilities, particularly in the human service world. We had to look at kind of separating the infected from the non-infected populations. And we needed additional human service programs that we will all talk about. And I've kind of defined these things between primary needs and operational initiatives. And next slide, Angela, please. So in primary needs, and I know that we've talked about it, but it bears repeating, on the PPE became the ultimate primary need as it relates to human services. And from our end, we identified, as most counties, the Office of Emergency Management was going to be the focal point of that. But the means of delivering that was just a partnership that we were able to develop with our sheriff's office that brought it out to brought the PPE out to every one of those facilities, every one of the towns. I think Terry talked about the local EMS and fire departments and police departments. Every day, the Morris County Sheriff's Office was just on the road delivering PPE. They and the County Office of Emergency Management worked tirelessly and seamlessly to address that. But really the key here, and I think we all learned this, at least I learned this mostly after 9/11, was that, you know, there is no really definition of critical worker or frontline worker. Everybody is a frontline worker. And the County Human Services became a required partner of OEM, and they have to have an in-depth knowledge of the community-based agency's needs. We were fortunate enough to have 11 facilities that we could set up immediately to help nonprofit residentials or community-based residentials separate their populations. And it's just not opening up those facilities, but it's ensuring that there's medical services, health services, nutritional services, social services, and security services, because you're mixing populations. And on top of that, you have to work with your local zoning officials and fire officials and subcode officials to ensure compliance as you moved along with that. It really was, it was nothing short of an art, and nothing short of picking up the phone and asking Terry if she thought of something, or Eve in Burlington County, or any of the administrators, even Tony, I called a couple of times, right, Tony? But you know, it really was a conversation that went through every day. Next slide, please. And then on the operational initiatives, you know, we had to separate populations. What we did, we brought in shower trailers, and we had a vacant building next to the homeless shelter where we separated new intakes from populations, just to ensure that we were kind of not mixing populations. We were looking to keep the non-infected separated from the infected. The Freeholder Board was just really phenomenally generous in special allocations, because they understood that the primary food pantries were just getting hammered. It was just nonstop, and our Freeholder Board was had gone out a couple of times and just gave them additional allocations. We made additional investments in mental health programs for both the adult population and the educational populations. We ensured that our emergency assistance and temporary assistance and food stamp operations continued to work. We actually placed portable hand washing stations in downtown areas that became a way of trying to mitigate the spread of the disease. And I think above all, you really have to keep an ongoing dialogue with your community-based agencies, because needs are going to change on a dime, and you need to be flexible with what needs those community-based agencies might have, and how we could help address those needs in partnership with them. So I believe that that's really relates to the human services pieces. And if there's not any questions, I'll turn it back. I think Tony's doing the labor issues.
Thank you, John. So would have been a lot easier if we could just focus in on the pandemic itself and the disease itself, the virus itself. But of course, we had to deal with keeping government operational. The next slide is Angela. So I had issued 6 separate administrative orders throughout this crisis, and most having relevant provisions as it pertained to the county workforce and the public sector unions. I'm sorry for that. People should know I'm busy. So we provided flexibility for our non-essential employees, not making them use accrued time in the beginning as they weren't coming into the building, as we had closed the building down, and also allowed them. One of the challenges were we weren't prepared for people to work remotely. We didn't have enough laptops, and that was a challenge. But where we could, and where people could do remote at-home work, we allowed them to do that. We basically ended all non-essential work throughout the county. We redeployed employees. So one of the good things and one of the saving graces, if you will, was that the court system closed down. So all of the sheriff's officers who normally would have been assigned to judges and the courthouse were available to help throughout the county for COVID-related responses to the public health emergency. And most of that was at our testing site for traffic control and keeping things in order. And that was, invaluable. We did close access to the county buildings, and while county government was still operating, we have closed it to the public, and in fact is still closed to the public today. We're doing only by appointment only here in Passaic County. And basically that's going to continue up until the point where the courts begin to open. So our administration building that I'm sitting in here today, the top 2 floors of it are courthouses, and our courthouse complexes, which there are 2 others, are all connected. So for all intents and purposes, each one of those buildings are considered a courthouse. And once the courts begin to opening up to the public again, we will probably open to the public here. The ironic thing is that there's not, and I don't know how it's been in Mars or Monmouth. But there has not been a huge outcry, people banging on the door saying, let me in, I need to, I need to, get my notary renewed. We've made accommodations, and we are now, in the beginning, we weren't doing it, but now if any of those things are happening, you can make an appointment and you can come in. Next slide, Angela. So throughout the course, we worked with the unions to make sure that we were getting their buy-in. I'm a big believer that unions can be your best friends or your worst enemy. And typically they're your best friends when you're communicating with them, when you're giving them the heads up so that they're not hearing something you're doing from one of their members, but they've heard it from you firsthand. And we've had, for the most part, very good cooperation with the unions here in Passaic County. I'll talk a little bit about one of our challenges in a future slide. But we sat with the unions, we talked about staggering shifts, we talked about providing them PPE and a safe environment for those who did have to come to work. We tried to make as many accommodations as we could for our high-risk individuals. We implemented temperature logs so that people coming in, we knew that at least did not have the 100.4 temperature that was, that was talked about by the CDC. And we also provided all of our employees, whether or not they lived in Passaic County or not, access to COVID testing. Next slide. So we are, I think, one of 4 or 5 counties left that still operates our long-term care facility. So Preakness Healthcare Center is our long-term care facility. It's a 406-bed facility, the largest county-run facility in the state. We were ahead of the curve in Preakness, so we stopped visitation by families before we were required to by the Department of Health. All of our employees were wearing N95 masks prior to it becoming mandatory by the Department of Health. And one of the other things that we did do was restrict secondary employment of our employees. And that's wasn't an easy decision by myself, my team, or the freeholders, because many of the people that work at Preakness are the lower end of the salary scales, the certified nurses, aides, who probably have the toughest job in the world, quite frankly. I think, but we were concerned that we didn't know where they would be working, right? Are they working in Walmart? Are they working at Target? What are those places doing to keep those employees safe? So one of the things that we did was we restricted the secondary employment at the facility. That, of course, did not sit well with the union, although we did speak to them before I issued the order. It did not speak well, did not go over well with them. And some of their membership, most of their membership understood it. Most of their membership complied with it. But nonetheless, they filed an unfair practice charge and sought injunctive relief, which thankfully for us, and I think, as we've all seen where the crisis have taken place in these long-term care facilities, it was denied by PERC. So basically what we did is we sat down with the unions and we negotiated hazard pay for those members as a way to try to bridge that gap of monies that they may have lost during not being able to have secondary employment. And the freeholders just adopted that at our last freeholder meeting, and that will be retroactive to the beginning of March, which was when we stopped the secondary employment. We did have some per diem employees that worked for us that couldn't leave their primary job, but we allowed them to come back after I lifted that administrative order, which I believe was also 2 weeks ago. And obviously, we offered additional overtime to all the employees there. And it was, the overtime was there. There was the ability for those employees to work overtime and to, again, try to make them whole, if you will. Our intent was not to hurt the employee, although their argument was we did, and we understood it. But, we had, at that time, our census was 360 plus residents, And obviously our first concern were the residents, their families, and other employees. Next slide. So again, we tried to provide clear and concise materials on leave eligibility for all of our employees as we began to bring them back. And as we sit here today, all employees are back working 5 days a week. There is nobody in Passaic County that is working remotely, but we tried to give them the materials that they would need to be able to make the decision, particularly as school was beginning to open, and whether or not they were going to choose to keep their child home and have them learn remotely. So we tried to make materials, create materials that would be able to answer those questions. And I do say, along with purchasing agents, one of the other unsung heroes have been our HR directors, who have really just been, it's been incoming, if you will, with employees wanting to know what rights they have, what they can do. And we all understand it, right? We all understand balancing our home life and our work life is not always easy. So again, we've tried to be as caring as we can to our employees and giving them the information that they need. And again, just as part of the the overall plan of when employees were working, so we tried to limit number of people in vehicles, whether it's our roads department, our buildings and grounds department, and even our sheriff's department. We've now installed separators in some of those vehicles, so we are back to having multiple people in a vehicle. We also were requiring that the same person use the same vehicle every day, thereby limiting the risk, but requiring them to wear masks, gloves, and then we sanitize each of those vehicles each day, as well as all of the departments where people were working. If there are any questions, I'm happy to answer those, but that is the end of.
So if I could, we'll move on to communicating and sharing policies, and then we'll again open it up for questions.
Hey, Johnny, we do have one question. I'm sorry, I had a hard time unmuting myself, which usually doesn't happen. So we have a question from Steve White. What future changes are anticipated to manage the next phase and long-term secondary effects of COVID-19 on county government? Example, cost savings to fit revenues.
Well, can we go through the last piece and then maybe we could all answer that question?
Yes, certainly.
Might be a little bit better.
Okay, very good.
So, Angela, next slide, please. I think one of the most important words Tony just used was a balancing act, and on the right-hand slide here, you see that, because that's, I think, what we all had to deal with going through this. I think that we had to acknowledge that there was some health and safety and family-related concerns by all our employees, because if we didn't do that, none of us would get any work done. And I think that we always say essential versus non-essential, but I kind of like to say essential versus less than essential, because there are some services that became less essential. They're not non-essential. I think, like in our world, I believe that a library, for example, Terry and I had this conversation yesterday. I mean, they were kind of shut down for a while. It's not that libraries are not essential. They just were less than essential as the virus hit. But we had to develop and implement flexible work plans that ensured the delivery of what we considered essential services. And we had to do that in a way that was sensitive to our employees. And those plans had to be refined as we move along. And I believe that that refinement process will continue as we move along. I kind of put a quote at the bottom about, remember that life is a mirror and you treat people the way you wish to be treated, because if we don't do that, we're just really not going to get any of our services delivered to the public. And that's really what we are here for. Next slide, Angela. We had to identify what county services would be considered essential, and we had to develop and implement work plans that focused on delivering those in what we could consider a safe environment, whether that is installing plexiglass or whether that is in emergency basic life support units that you see at the bottom of your screen. We here did develop and we did allow work from home where possible. And honestly, we still do that, some of that. We developed temporary alternative work days and work weeks. Initially, we had, a couple weeks on and 2 weeks off where we could bifurcate the staffs. They are all back to full-time work, but back doesn't mean, at least for Morris County, back doesn't mean back in the office. If people can work from home and their work can be monitored from home, we still allow that. We had to ensure to the greatest degree possible that PPE and health-related protections were put in place. We did, as Tony indicated, offer hazard pay for critical frontline workers. We found that to be effective. In particular, to those workers that were on the front lines every day, including the correctional facilities, because our correctional facility, which does house Sussex Correctional Facilities, had a significant COVID outbreak, which ultimately impacted the corrections officers as well. And so, we needed to make sure that we provided and treated our employees as good and as right as we could possibly do that. Next slide, Angela, please. And kind of, I use the word return to normal environment, but I don't know what that means. I don't know that if any of my colleagues could define what that means, because that's going to change as we move along. And when we return to the office, and I think I should have, when I revisited this slide after Terry finalized it, and I thank Terry and her staff for doing all this work, it's really not returning to the office. It's kind of returning to business, because not everybody here returned to the office. There is still work from home that still exists. And we needed to be sensitive now as the schools started, because we have to understand that the virtual school schedules or modified school schedules will have an impact on our employees. We have attempted to the degree that we can, be sensitive to that and be flexible to that while addressing the needs of the county entities. And so I don't really know how to respond to, what's going to happen going forward, other than to say that I believe as a group, we all have to be flexible to hear what the concerns are, to understand what our primary needs are, and to address our primary services as best as we can. And I will also turn that over to Terry and Tony to maybe put their comments in. There is no black and white answer. I believe the answer is going to be, we have to wait and see, and we have to we're kind of putting out a fire, I believe. But go ahead, Terry. I see you have some thoughts here.
Actually, I was just unmuting because I didn't want to start to talk and not be able to anybody to hear me. I don't think we know what the future's going to be, or how we're going to, what we're going to look like, because I think that we've got the pandemic that needs to be dealt with. I mean, numbers are down, we're doing better, but there's still not there's not a treatment or a vaccine for it. And we don't know what the financial impact is going to be. We haven't seen that yet, and I don't think we're probably going to till 21, 22 maybe. And then, the human services aspect of this, the mental health aspect, I think, is down the road. The addictions, the suicides, all of those things that we're starting to see go up.
Domestic violence also.
So, right, divorce, all of those things. So I think we're just going to need to be flexible. I think we're going to need to continue to lean on one another. And it's sort of, we're going to have to deal with it as it comes. I think long-term planning is going to need to be flexible.
And if I could just, for me, here in Passaic County, to Mr. White's question of, is there a silver lining? I think for me, the silver lining is the closer relationship that county government has now built with our municipalities. So they're always a cordial relationship, and but for those of us who have been in county government long enough, right, we're kind of the easier target with the municipalities. Like, yeah, what does the county do for us? But I think during this, and I'm sure, and I know for a fact that both Terry and John did the same thing. We started having, just like we were having calls with the state, we were having calls with our mayors. And I think that relationship and the appreciation that The county was kind of the lead and was there for the municipalities. I think, again, speaking for Passaic County, that relationship is hopefully going to continue. And although those calls have now kind of cut back to once a month, many of the mayors have said to the freeholders and I that they'd like to continue, even when and if we get past the pandemic, to continue to have those once a month calls, because not only were we in it together, they learned from each other, just like we said earlier how as county administrators we learned from each other and relied on each other, and sometimes it was just a mental health call. A couple of times, I picked up the phone and called Benani because I was just ready to pull my hair out, and just to have somebody that understood what you're going through. So for me, if there's a silver lining, that would be it.
For me, I have all the invoices that I'll be sending you for all those times you called me.
Well, you should have called me, and maybe you wouldn't have pulled your hair out.
I have none left. No, but I think you're so right. I mean, it was just, there are no rules. There was no game plan. You had to develop it on the fly, and there was, without the relationships that you have both up the chain, down the chain, across the chain, it just wouldn't have happened.
Yes, as my father would say, with the school of hard knocks, right? And I think Terry alluded to it earlier. We all now have a PhD in crisis management, not because we wanted to, but because we had to. And we all made decisions that in my career I never thought I would have had to make. I mean, basically closing county government to the public, and I mean, who would have ever thought?
That's true. Who would have ever thought? And I think, what I sensed from my end, and I guess if we all watched TV last night, you saw this enormous teamwork in state government. Nobody cared what party you belonged to. Nobody cared about any of that stuff. It was all just, how do we address this and how do we get this done? I'll speak from one of the 12 counties that didn't get any CARES money, because you guys got some direct CARES money. I mean, we struggled in a little bit of a different way initially. But we were able to work together. We were able to get the governor's office to understand that, hopefully some of that money was going to come down here, and ultimately it did. And all of that happened because of the relationships that we have and the trust that we built with one another.
And one other little PSA, if you will, John Donadio has been invaluable throughout this pandemic for all of us, taking the lead on issues and bringing the counties together for that common cause that NJAC is there for. And I think we all, at least, again, I'll speak for myself, but I think I could speak for John and Terry. We all, think the world of NJAC and the association, what it means to all of us on a day-to-day basis. But it never became more evident than these past 6 or 8 months to have an organization that was there fighting for all of us, and including, although it didn't affect Terry and I, including being the advocate for the other 12 counties to get, monies to help them do the testing and the things that they needed to do to protect their residents. So again, John, not to embarrass you, I see you turning all red, but invaluable to have you as that resource. And I know that it helped me get through some issues, and I'm sure it helped all the other 20 counties as well. So kudos to you and NJAC, and for all of the sponsors that are here. You should know that this organization is a worthwhile organization, and your sponsorship and your support is greatly appreciated, because it allows us to have someone like Mr. Donadio and his staff working on our behalf.
I hope you recorded that, Angela. That was. Thank you, Mr. D. I appreciate it. Okay.
And the $1.50 you said you were going to give me if I said that, you could Venmo it to me.
I'll give you $2 for that. No, thank you. We do have one final question from our audience, but I again just want to thank Tony and John and Terry, and I have to say, being part of what we went through was something that I, quite frankly, will never forget, because you saw you saw the best in people. And I saw our county leaders like Tony and Terry and John, and quite frankly, all of our county administrators, they rose to the occasion and they communicated with each other. They worked tirelessly day in and day out. And again, it moved me just to the point where I won't forget it. And I can't thank you enough for all of your hard work and protecting, the health, safety, and welfare of residents, across the Garden State. I don't think, the general public appreciates what you've done and how hard you've worked, but I certainly do. So thank you. Before we close out, I have a question concerning commercial. I'm going to tell you what, this is a little bit of a complicated question from an anonymous attendee. So I'm going to copy it, send it to our panelists, and then I promise that we'll get back to you if you don't mind. So with that, with no further questions, and even though we went over our time, I thought this was a fantastic panel discussion. And again, I can't thank you enough. We had over 104 people on this virtual workshop, which exceeded my expectations. So this was,
I guess, because of the position.
So with that, we look forward to seeing you this time next week when we will hear from our county emergency management coordinators, who again certainly played a vital role in managing the COVID-19 public health crisis. So thank you to everyone who participated, and again, thank you to all of our panelists. It was fantastic.
Thank you all.
Thank you all.
Great job.
Thank you.